Hey everyone, welcome to another deep dive into the fascinating world of infectious diseases. We're focusing on you guys again, the medical microbiologists out there, or anyone really, who's captivated by the fight against antibiotic resistance. And today we're tackling a bit of a powerhouse, I'd say. Linezolid. We're going to be using the World Health Organization's AWARE publication, that's Access, Watch, and Reserve, as our roadmap for this exploration. So buckle up and get ready to unlock the secrets of Linezolid.
It's a good one. I'm excited to jump in.
Right. It kind of feels like it doesn't always get the attention it deserves.
Yeah, it's a little under the radar.
Yeah, it's kind of a hidden gem. So let's start with the basics. What exactly is Linezolid? If someone's hearing about it for the first time, what's the quick rundown?
Sure. Linezolid is a synthetic antibiotic. It was approved, back in the early 2000s. It belongs to a class called oxazolidinones.
Okay.
And I think what really makes it stand out, it's effective against some pretty tough bacteria.
Okay, so we're talking about the bacteria that really give us microbiologists nightmares.
Yeah, exactly. The ones that are resistant to a lot of other things.
So give us the rundown. Who are these formidable foes that Linezolid can tackle?
Well, the one that always comes to mind first is MRSA. Methicillin-resistant Staphylococcus aureus.
Right.
That's a big one. But then you've also got VRSA.
Okay.
Vancomycin-resistant Staphylococcus aureus, and VRE.
All right.
Vancomycin-resistant Enterococcus. These are some of the, really tough ones to treat, and Linezolid can be really effective when other antibiotics just aren't cutting it.
Wow. So it sounds like Linezolid is a bit of a specialist, right? Like we bring it in for the really challenging cases, kind of like the superhero of antibiotics.
I like that. Yeah, it kind of swoops in and saves the day.
Exactly. And I understand it's not just limited to those. Like there's another big one that Linezolid plays a role in, right?
Oh, yeah. It's also used to treat multi-drug resistant Mycobacterium tuberculosis.
Oh, okay.
Which is, as you know, a major global health problem.
Yeah, absolutely. So it's kind of a versatile weapon then in our arsenal. Capable of taking on a variety of different tough adversaries. Now let's shift gears a bit and imagine we're clinicians.
Okay.
We've got a patient in front of us who has a serious infection. What are some of the clues, the red flags that might make us think, maybe Linezolid is the right choice here?
Right. Well, it's important to remember every patient is different.
Of course.
But there are certain infections where Linezolid is more likely to be needed, like, for example, severe skin and soft tissue infections, particularly if we think MRSA might be involved.
Right.
That's one situation where Linezolid often comes into play. And then also pneumonia, especially if it's caused by resistant organisms.
Okay, so we're looking for clues based on the patient's symptoms and the type of infection they have.
Exactly.
But obviously we can't just rely on suspicion, right? We need to confirm things.
Oh, absolutely.
We need evidence.
We need proof.
Exactly. So what kinds of laboratory and microbiology tests are crucial in helping us determine if Linezolid is the right weapon to use?
Well, I'd say the most important one is culture and sensitivity testing.
Right.
We take a sample from the patient, we grow the bacteria in the lab, and then we see which antibiotics it's susceptible to.
Okay.
And that includes testing against Linezolid.
So it's not just about identifying the bacteria, but also understanding its weaknesses.
Exactly. We need to know if Linezolid can actually kill it.
It's like finding its Achilles heel.
Exactly.
Now, what about other laboratory tests? Are there things we should be monitoring when a patient is on Linezolid to make sure they're responding well and to catch any potential side effects early on?
One of the most important things to monitor is the patient's complete blood count, or CBC.
Right.
Linezolid can sometimes cause a decrease in blood cell production, particularly platelets.
Oh.
So we watch the CBC closely to make sure the patient's platelet count isn't getting too low.
So we're being proactive.
Yeah, definitely. We want to catch any problems early.
Catch those problems before they become serious.
Ah.
Now let's talk imaging for a second.
Yeah.
Does imaging play a big role in deciding whether or not to use Linezolid?
Imaging isn't usually the primary factor in deciding to use Linezolid.
Okay.
But it can be helpful in understanding the extent of the infection.
Well,
Like if a patient has pneumonia, a chest x-ray can show us how much of the lung is affected.
so it's like having a map of the battlefield.
Yeah, exactly. It helps us see what we're dealing with.
All right, so we've talked about how Linezolid is a powerful antibiotic, effective against some really tough bacteria. We've gone over some clinical clues that might suggest its use and the lab tests that help us confirm that need. We've even touched on the importance of monitoring blood counts and using imaging to get a clearer picture of the infection. Now, let's dive into the actual treatment of infections with linezolid. But before we get into the nitty-gritty details, I think it's important to acknowledge that treating these resistant infections isn't just about throwing an antibiotic at the problem.
Right? You're absolutely right. It's much more than that.
It's a bigger picture.
It's a whole approach.
Yeah. So what does that involve besides the antibiotic itself? What else is important?
Well, we call it supportive care.
Okay.
It's all about helping the patient's body fight the infection along with the linezolid.
So it's about giving their own immune system a boost.
Exactly.
And making sure they're in the best possible shape to recover.
Yeah, things like making sure they're well hydrated, getting enough nutrients, and sometimes even procedures like draining abscesses.
So we're creating a supportive environment.
Yes.
Where linezolid can work its magic.
Exactly. It's all about working together.
Now, let's talk about the star of the show, linezolid itself.
Okay, let's get into the details.
What are the specifics of using this antibiotic?
Well, let's start with dosage. For adults, the usual dose is 600 milligrams every 12 hours.
Right.
And one of the nice things about linezolid is that it can be given both intravenously and orally.
Right, so there's flexibility depending on the patient's needs.
Exactly. And then for children, the dose is based on their weight.
Okay.
Usually 10 milligrams per kilogram of body weight every 8 hours.
And for the tiny babies, the neonates.
Oh, yeah. Neonatal dosing is a bit more complex.
There are specific guidelines, right?
Yes. The AWARE document goes into detail about that.
Perfect. All right, let's talk about how long a patient typically stays on linezolid.
Well, the general principle is to use it for the shortest duration possible.
Okay.
We want to treat the infection effectively,
right,
but also minimize the risk of side effects.
So it's about finding that balance.
Exactly. Ideally, we try to keep treatment under 4 weeks, but it really depends on the individual patient and the infection.
Okay, so we've covered dosage, we've talked about duration, and we've stressed the importance of supportive care. Now, I'm curious about how linezolid actually works at the cellular level. What's going on there? How does it kill those bacteria?
It's pretty fascinating, actually. Linezolid has a unique mechanism of action.
Okay.
It doesn't attack the bacterial cell wall like some antibiotics.
Okay.
It goes after their protein synthesis machinery.
Interesting. So it's disrupting their ability to make the proteins they need to function.
Exactly. It binds to something called the 50S subunit of the bacterial ribosome, which is basically the protein factory of the cell.
So it shuts down their whole operation.
Pretty much. No proteins, no growth, no replication.
Wow, that's pretty clever. And I imagine that unique approach is part of the reason why it's so effective against those resistant bacteria.
Exactly. They haven't developed resistance to this mechanism yet.
Which brings us to a very important question.
Yeah.
How widespread is resistance to linezolid? Are we seeing it popping up everywhere?
That's a key question. And so far, the good news is that resistance is still relatively low.
Okay, that's good.
But this is a big BUT. We have to be careful.
Right, because we don't want to overuse it.
Exactly. Overuse and misuse of antibiotics are the main drivers of resistance.
It's like we're giving those bacteria training ground to evolve and outsmart our drugs.
Exactly.
So responsible use, stewardship is really key here.
Absolutely.
So let's talk about the specific bacteria that linezolid is most often used to fight. We've mentioned a few already, but can you give us a more complete picture of its target pathogens?
Sure. So we've already talked about MRSA and VRE.
Right.
Those are definitely high on the list. They're major causes of healthcare-associated infections.
Okay.
And then another important one is penicillin-resistant pneumococci.
Oh, right. Those can cause some serious problems like pneumonia and meningitis.
Exactly. And linezolid can be a good option for treating those infections.
So we've got a good sense of linezolid's strengths now.
Yeah.
Its unique mechanism of action and the specific bacteria it targets.
All right.
Are you ready to put our knowledge to the test with some exam-style questions?
Always up for a challenge. Let's see what you've got.
All right, here's question number 1. What is linezolid's primary mechanism of action? Is it A, inhibition of cell wall synthesis, B, inhibition of protein synthesis, C, inhibition of DNA replication, or D, inhibition of folic acid synthesis?
All right, listeners, think about that one for a moment. We'll be right back to break down the answer and explain the reasoning behind it. All right, so that first question, the correct answer is B,
Okay.
inhibition of protein synthesis. Linezolid works by binding to that 50S subunit of the bacterial ribosome.
Right.
And that essentially stops them from making the proteins they need.
Right.
It's like shutting down their production line.
No proteins, no growth.
Exactly.
Okay, what's question number 2?
All right, this one's a bit more specific. What's the usual dosage of Linezolid for an adult, assuming their kidneys are working fine?
Okay, listeners, time to recall those details. No peeking at your notes.
Yeah, no cheating.
We'll be back in a sec with the answer.
Okay, time's up. The correct dosage is 600 milligrams every 12 hours.
All right.
And remember, that's for adults with normal kidney function.
Right, because dosage adjustments might be needed for patients with kidney issues.
Absolutely. Always got to consider the individual patient.
Exactly. It's not just about memorizing numbers.
Right.
It's about applying them in the real world.
Exactly.
Okay, what's the next challenge?
All right, let's switch gears a bit and think about safety. Question 3. Which of these is a potential side effect of Linezolid that we need to monitor for? A, hypoglycemia, B, hyperkalemia, C, thrombocytopenia, or D, hepatotoxicity?
Okay, this one is important. Listeners, think back to what we talked about earlier regarding monitoring Linezolid patients. What were those key lab tests we mentioned?
Yeah, what were we keeping an eye on?
Right, we'll give you a moment to ponder.
Okay, so the correct answer is C, thrombocytopenia.
Right.
Linezolid can, in some cases, lead to a drop in platelets. That's why we check those CBCs regularly.
Exactly. Early detection is key.
Absolutely. We want to catch it before it becomes a problem.
Okay, 2 down, 3 to go. What's next?
All right, let's dive into a bit of antibiotic stewardship with this one. Question 4. What's a really important factor when we're figuring out how long to treat someone with Linezolid?
All right, listeners, think back to our discussion about balancing the benefits and risks of Linezolid. What was that main principle we emphasized?
Yeah, what's the guiding principle for treatment duration?
Think about it carefully, and we'll break it down in a sec.
The key consideration here is to use it for as short a time as possible.
Right.
We want to treat the infection, of course.
Right.
But we also want to minimize the risk of side effects.
Exactly. It's a balancing act.
Exactly.
Yeah.
Ideally, less than 4 weeks. But again, it depends on the individual situation.
Right. Every patient is different.
Absolutely.
Okay. Last question.
All right, here we go. This one tests your knowledge of Linezolid's target range. Which of these bacteria is not usually something we'd use Linezolid for? Is it A, MRSA, B, VRE, C, Escherichia coli, or D, penicillin-resistant pneumococci?
All right, listeners, think about the types of bacteria that Linezolid is effective against. Which one doesn't really fit in that category?
Yeah, which one stands out?
Take a moment to decide, and we'll reveal the answer shortly.
All right, the answer is C, Escherichia coli. Remember, Linezolid is primarily used against gram-positive bacteria.
Right.
And E. coli is gram-negative.
So it's outside Linezolid's typical range.
Exactly.
This highlights a really important point, doesn't it?
Yeah.
Linezolid is a great tool.
Yeah.
But it's not a magic bullet.
Right. It has its limitations.
It's crucial to understand those limitations.
Absolutely.
All right, well, that wraps up our exam questions for today. Hopefully everyone enjoyed that little brain workout.
Uh-huh. Yeah, it's always good to test our knowledge.
Now let's step back and recap some of the key takeaways from our deep dive into Linezolid.
Sounds good. Let's do a quick review. We started by defining Linezolid. It's a synthetic antibiotic, one of those oxazolidinums.
Right.
And what makes it so valuable is its effectiveness against those tough gram-positive bacteria.
Especially the ones that have become resistant to other antibiotics.
Right, like MRSA, VRSA, VRE, and even multi-drug-resistant TB.
Yeah, we talked about the clinical presentations that might make us suspect a need for Linezolid and the lab tests, like cultures, that help us confirm that.
Absolutely. We also talked about the importance of monitoring, like keeping an eye on those blood counts.
Right, watching out for any signs of that myelosuppression.
Exactly.
And we talked about how imaging can help us get a better understanding of the infection.
Yeah, like seeing how extensive it is.
Then we moved into the specifics of treatment with Linezolid. We stressed the importance of that supportive care alongside the antibiotic.
Right, it's a team effort.
And we talked about dosage, duration, all those details.
And of course, we dug into that unique mechanism of action.
Right, how it messes with bacterial protein synthesis.
Yeah, it's a pretty clever strategy.
And we touched on the issue of resistance. It's still relatively low for Linezolid.
Yeah, which is good news.
But we can't take that for granted.
Definitely not. We need to be responsible.
Absolutely. We as microbiologists have a big role to play in that, right?
Oh yeah, we need to be champions for antibiotic stewardship.
Educating our colleagues, making sure everyone understands the importance of using these antibiotics wisely.
Couldn't agree more. Well said.
Now, before we wrap things up completely, I want to leave our listeners with one final thought to consider. We've talked a lot about the strengths of Linezolid.
Yeah.
And which bacteria is really good at fighting.
Right.
But what about its weaknesses? Are there any situations where Linezolid might not be the best choice, even if the bacteria we're dealing with is susceptible to it?
Yeah, that's a good point. No antibiotic is perfect, right? And Linezolid does have some things we need to keep in mind. One thing is drug interactions.
Okay.
Linezolid can interact with some other medications.
Oh.
Like certain antidepressants, for example. And that can lead to a condition called serotonin syndrome.
Oh, wow.
Which can be pretty serious.
So that's something to be really careful about.
Definitely. We always need to check what other medications the patient is taking.
Right. So it's not just about the bug.
Exactly. It's about the whole patient.
It's about the whole picture.
Absolutely.
Now, you mentioned side effects earlier. Are there any other potential side effects besides those blood count issues we talked about?
Yeah, there are a few others to keep in mind. One that can be a concern, especially with longer courses of treatment, is peripheral neuropathy.
Okay, and what is that exactly?
It's basically damage to the nerves in the hands and feet.
Oh, okay.
It can cause numbness, tingling, even pain.
So that could really impact a patient's quality of life.
Definitely. It's one of the reasons we try to use Linezolid for the shortest duration possible.
Right. Those side effects just reinforce that principle.
Absolutely. We want to balance effectiveness with safety.
And of course, we can't forget about that big elephant in the room, antibiotic resistance.
Right.
Even though resistance to Linezolid is relatively low right now,
yeah,
that doesn't mean it's going to stay that way.
Exactly. We have to be proactive.
So as medical microbiologists, what can we do to try and preserve the effectiveness of Linezolid? What steps can we take to fight that resistance?
Well, I think one of the most important things is education. We need to educate our colleagues, other doctors, nurses, pharmacists.
Right. The whole healthcare team.
Exactly. We need to make sure everyone understands the principles of antibiotic stewardship.
So what does that involve? What are the key messages?
It's about using antibiotics only when they're truly necessary.
Okay.
Choosing the right antibiotic for this specific infection.
Right. So it's tailored to the individual patient and their situation.
Exactly. And making sure the dose and duration are appropriate.
So it's not just about throwing an antibiotic at every problem.
No, it's about using them wisely.
It's about being strategic.
Absolutely.
And I imagine educating patients is also important.
Oh, yeah. Definitely. Patients need to understand when antibiotics are needed and when they're not.
Right. And the importance of taking the full course as prescribed.
Exactly. It's a partnership between the healthcare team and the patient.
It's about empowering patients to participate in their own care.
Absolutely.
Well, I think we've covered an incredible amount of ground in this deep dive. We've talked about Linezolid's strengths and weaknesses, its unique way of working, and how important it is in the fight against resistant infections. We even got to test our knowledge with those exam questions.
Yeah, those were fun.
So, as we wrap up, what are some final thoughts you'd like to leave our listeners with?
I guess my main takeaway would be that Linezolid is a really valuable tool, but it's not a magic bullet. We have to use it carefully and thoughtfully.
Right. And we need to be good stewards of this antibiotic.
Exactly. We want to make sure it's still there for us when we need it in the future.
Couldn't agree more. Well, I think that brings our deep dive into Linezolid to a close.
It's been a great discussion.
I want to thank you for sharing your expertise with us today.
It was my pleasure.
And to all our listeners out there, thank you for joining us on this journey into the fascinating world of medical microbiology. We'll see you next time for another deep dive into a different corner of the microbial universe.